Hi, this is Teresa Martin from Lower Cape TV with this special episode of Legislative Update. With me for a second round of conversation is State Senator Julian Cyr. Thank you so much for coming back.
You bet, Teresa.
I mean, there is just so much stuff happening at all different levels right now, from the local to the county to the state. And one of the areas that we've been talking a lot about is the logistics of getting healthcare, getting tested, getting care for what happens if you are testing positive. And could you update us a little bit about what has been going on, what kinds of things you've been working on in that area?
So there's a whole set of preparation so that we can handle and anticipate what's called the surge. This is the influx of patients that we expect to see who are going to not only be experiencing COVID-19 symptoms, but their symptoms are going to be to a point that they're going to require advanced medical care, and they're going to require hospitalization. Mm-hmm. And so what Cape Cod Healthcare and Cape Cod Hospital and the community health centers and others have been preparing for is how do we meet that surge. So efforts have actually been in place for quite some time, actually around how do you triage people who are coming into the emergency department. That's actually done in a tent outside of the hospital, to then looking at how do we redirect people, how do you make sure that the people who need acute care are able to get it, and then how do you direct people who may not need like a very high level of care, but do need some sort of medical care and attention, and how do you provide services for them? And then also, how do you create a system for people to step down care as well? So Cape Cod Healthcare has essentially doubled the beds that they have at Cape Cod Hospital, which is just simply remarkable. But they also have worked to identify an additional 300 COVID step-down beds, meaning beds that people who may not need to be in a hospital but do need some medical attention while they're recovering. And so they've been able to identify some former skilled nursing facilities in Falmouth and in Harwich that are going to serve that function. So that's going to expand our bed capacity. We also are working to set up step-down COVID capacity beds at Joint Base Cape Cod, which is another asset that we have using the gymnasium that they have at Camp Edwards there. So that's going to be another location. All of this is to try to right fit people's need for care, and to make sure that our healthcare system can meet the challenge of that surge. It's going to be a very, very big challenge. Earlier, we spent a lot of our time trying to obtain what is called PPE, personal protective equipment. Simply we were not prepared for that. There was a lot of Herculean efforts there. My understanding is that our hospitals here have about 2.5-3 weeks supply of PPE, but we continue to be mindful of that. We also need to get PPE to first responders and now to grocery workers and other people who are doing essential work.
So explain, I've had this visual image, and I'm sure other people do too, of the supplemental locations. So I picture what happens during a traditional kind of emergency. There's a big blizzard, and now there's all these cots lined up. And that is such at odds with the image of social distancing and keeping sick people from making each other sicker. So can you help me understand and visualize what that is?
Sure. So part of the reason why Cape Cod Healthcare is using, my understanding is they're using these former skilled nursing facilities, right? Is they're built to have individual rooms that sort of can function in a medical way. When we're building out spaces like the Convention Center in Boston or the DCU Center in Worcester, or what will be built at Joint Base Cape Cod, that's actually sort of constructing sort of pods almost, right? So that people are separated. And if you just Google this, your viewers will sort of can see a myriad of examples. There's actually, you can watch this actually happen in there's time lapse that I think we have of a convention center being built out. So in some cases we need to build things. In other places, we're going to use existing infrastructure, existing buildings that were set up to have some sort of medical services to provide those COVID step-down beds.
Now, in a region like ours, which has a significantly older demographic than other parts of the state, does that make the need greater here?
Potentially. We have a very vulnerable population. Barnstable County is the oldest county in Massachusetts as of the 2010 census. We have the third oldest county in the country. So we've got some high risk there. We're also kind of broadly spread out, and I think of your viewers and where I live, on the Outer Cape. On a good day, we're an hour from the hospital. So just our geographics make getting people care and getting people into the hospital a challenge. If you look at how COVID tends to manifest and how the disease manifests in people, they tend to be able to manage it at home until they can't. And so that's what they all are working. We're all working to do, led by the hospitals, which have done. From my perspective, Cape Cod Healthcare has. I think I was saying in the earlier segment, it's the most reassuring call I have each week is with the CEO of Cape Cod Healthcare and their team, seeing all of what they're able to put in place. But it's going to be a tremendous challenge to meet the surge, and then we're going to need to have this capacity up and running and continuing, because we do expect every summer we have a significant population influx. We will have some level of population influx, even if this summer is muted or not even really able to happen. We will see an increase in people coming here, and so we're going to have to keep up that level of care.
Well, I know that there are some state house actions to supporting this as well. There's some financial relief for healthcare organizations. There's some liability relief possible.
Yep.
Can you talk a little bit about those?
We're really worried about our hospitals and our community health centers to prepare for the surge have essentially focused sort of full time 24/7 on preparing for COVID, and yes, also other kind of really acute emergencies that come through the emergency department. That has meant that hospitals and community health centers have foregone elective procedures, are not having regular appointments. All the ways that they get revenue, they've essentially given up. And so there has been several releases of money. First, $250 million was in advance payments from Medicaid, was given to hospitals and community health centers. Another round now of $800 million is flowing to them. This is really critical, particularly because organizations like Outer Cape Health Services, which is our community-based health center out here on the Outer Cape, they actually had to lay off a number of their workers because they frankly didn't have the money to pay them, and they weren't doing sort of essential work. What we need, though, and I really admire Cape Cod Healthcare for doing this. Cape Cod Healthcare has not actually furloughed much of any of their staff yet, and they're trying to keep them on the payroll because they know they're going to need them to respond when we have the surge. So we're trying to funnel as much resources as we can to hospitals, to community health centers, also to skilled nursing facilities and others who are, essentially their revenue has been flipped upside down, and it's a tremendously difficult situation. Hopefully there's going to be more dollars that are flowing, particularly from the federal government and also from the state. On liability, there's a bill that's been filed essentially to provide some liability protections to healthcare workers in this pandemic. That's a bill that's been filed by the governor. It's something we've been looking at, and I expect we'll take action on that soon.
So we have an economic impact of this as well. And in our country, economics and healthcare intersect. If someone loses their job and loses their health care, how is Mass Health poised to respond?
So Mass Health and the Healthcare Connector both have open enrollment right now. So if you lose your health insurance, or if you don't have health insurance, you can apply. And if you qualify, and if you're unemployed, you're going to qualify for Mass Health. We really urge anyone who is in that predicament to do so. And that's something here in Massachusetts we will continue to do. We have the strongest coverage in the country for insurance. We have the highest levels of insured folks. That's going to be an advantage for us, has been and will be through the course of the pandemic. I really look at some of these other states that have, much lower rates of employment, who didn't expand Medicaid under the Affordable Care Act. They're going to have a much tougher time even than we're going to have. So
right now, businesses that are non-essential are in a shutdown mode through May. And I've had a lot of conversations with people with this definition of essential and non-essential.
Yeah.
Can you share a bit? How did the state come to these definitions? And, in some states, I know guns are essential, liquor is essential. People are arguing marijuana should be essential. I'm thinking
Yeah.
ice cream is more essential. I mean, how are we defining this really?
Yeah. So the definition that the Baker-Polito administration has used in the executive orders, and these have come through executive orders through the governor's emergency powers. That's actually based on guidance from the federal government that they've been using. We've tried to use a uniform way to look at this. That primarily is grocery stores, other food service establishments, again, only through delivery. Liquor stores are included in that. Marijuana dispensaries are not, or recreational dispensaries are not. The concern about that, or the concern from the governor, has been that we're the only state kind of in the region, right, who has broad recreational marijuana, and so there's a concern about an influx of people coming in. I'm not sure if I buy that, but so that's something that's not included. But they're trying to use a federal guidance. What's important to know around the essential worker designation is that if a municipality believes, it's up to the municipalities to enforce this, and if a municipality, a town, essentially believes that they can't enforce provisions, related to allowing essential work, then they can take action to cease that work. So, for instance, on the islands, both Nantucket and Martha's Vineyard essentially did not feel that they could guarantee that construction was occurring on island that complied with the essential worker provisions, right? There had to be a hand washing site, bathrooms, and people had to be distanced from one another. And they actually were able to take action to have an order where they're not allowing construction. What's included in this? Leisure accommodations are not considered essential. So hotels and motels, and also Airbnbs and rentals. I think it is safe to say that we expect the May 4th, the order that goes until May 4th, to be extended. It looks like we're going to be seeing the surge here in Massachusetts sometime around April 20th, but we're going to likely need to continue this for some time. And I also, I think that we're not going to, how this ends is not going to be clear and consistent. I don't think we'll just be able to sort of turn a switch and say all clear and sort of go back to life as normal. I don't think that's going to happen. I think this is going to have to be opened up, piecemeal, bit by bit, and we're taking this day by day.
Well, certainly Airbnb, rentals, hotels, motels, that's a big issue for our region.
It's a huge,
2 months.
Even in housing, there's a lot of people who, both locals, right, who do the shuffle, right? They maybe rent out their house, move into a shed or the campground to make some ends meet. And then a lot of second homeowners actually have financed their second homes in part by having rentals that help pay the mortgage. So there's a lot of uncertainty there. I do think, though, this is a really good call. I have heard a tremendous concern from constituents about a perceived influx in visitors already and a future influx of visitors. Hey, look, we're Cape Cod, so we're in the business of hospitality, but we have very limited medical resources and public safety resources. I've heard a lot about this. I've heard from people who want us to close the bridges, which when I don't have the authority to do that. Essentially, we can only do that under martial law. These are federal highways, but also, Cape Cod's a place that there's 215,000 people who live here year round, right? So we're not, people have been talking about the Outer Banks, Duck, North Carolina, which is sort of the biggest, the town in the Outer Banks. There's 3,000 people who live there year round. About, that's one or two of our little towns, right? We're a much bigger place here. But what I've been telling people is this, I understand why folks would want to come here and ride this out. We really want to encourage them to think twice about coming here. They need to understand that we have very limited medical resources and public safety resources, particularly this time of year, right? It's not July when our hospitals and our public safety is staffed up. And so folks should really think twice about coming, particularly if you're in a high-risk group for COVID-19. And if you do come, we ask that you, get all your provisions that you need, for a 14-day quarantine off Cape, to get all those provisions and then come and adhere to a very strict 14-day quarantine and that'll keep everyone in our community safe. I will say, though, anecdotally, of the cases that I know of friends that I have who've been public about their COVID status and having had COVID, and thankfully come through it. Most of these are people who had traveled to New York, to New Orleans, or to Florida, and so we're seeing community spread happen here in Cape Cod already, because Cape Codders are folks who, particularly in February and March, would like to get away, get off the island. So I think just being very honest about what our resources are, encouraging people to think twice about being here, and if they do come, make sure that they take precautions to keep everyone safe.
There's one piece of legislation that I understand has passed that is of particular benefit to people who are in the food industry here, who have already stocked up for the season, and that's takeout alcohol?
Yes. So as part of one of the municipalities' bills related to municipal issues that we passed, we do allow the takeout of beer and wine from restaurants. This is an understanding that a lot of restaurants may have quite a bit of inventory that they otherwise would be sitting on, and it's a way for folks to also support their local food service establishments that have decided to stay open and provide either delivery or takeout. So that was something we heard a lot about. We heard a lot about that. Definitely have heard a lot about marijuana. You think the governor's not. The governor has some pretty significant concerns there, so I don't know if that's going to be changed, although I've raised that. So certainly people are looking for ways to ride this out.
Yeah. Well, that said, we've actually used up the time we had allotted, and I really appreciate you chatting about all this stuff, because like I said, it's a moving target. Things are happening literally every day, which is, to me, heartening that we are responding as a region and as a state.
We're so fortunate to have, just remarkable people who, are stepping up, whether, they're healthcare providers and folks on the front lines in our hospitals and health centers, to the people who are working to keep all the rest of us safe, the grocery store workers and people working in pharmacies, and food service workers. And I said in the earlier segment, right, we're more dependent on them now than ever. And I think that if you look at who this pandemic is hitting hardest, it's the people who've been the most vulnerable. And so that's something I think we need to keep in mind now, and we need to keep in mind and really remember once it's all over. Just want to give another plug. If you are looking for resources, help, guidance, information, please go to senatorcyr.com. That's senatorcyr.com. We have a whole host of resources there. And please reach out to me individually if there's anything we can assist with.
Great. Thank you very much for being here. This is Teresa Martin with Lower Cape TV, and with me today in this special episode of Legislative Update has been State Senator Julian Cyr. Thank you.
Take care.